Do you suffer from a nagging, burning, painful spot near your shoulder blade at your back? Maybe it's hard for you to take deep breaths sometimes. Maybe you're getting some wrapping chest pain. What you might be feeling is an irritation of the ribs where they meet the spine. My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley. And today we're going to talk all about this rib irritation, what it looks like, what it might feel like, and what you can do to treat it. So first, let's talk about the anatomy. So our rib cage starts at our sternum, our chest bone, and then those ribs wrap around and they make a couple of attachments with the vertebrae, the bones of the spine, kind of like that. And sometimes those joints, those attachments can get irritated, inflamed, or maybe kind of a little stuck and not moving properly. And so then that can cause muscle spasms, so there might be a ball of muscle in that area. It can cause nerve irritation, so it may feel itchy or it might feel burning, or you might get wrapping chest pain in there. Some people even describe a little bit of achy pain into the back of the arm. Now, we see this problem in people who work in rounded postures. So if you have to reach with a mouse, or you're in that sustained rounded posture, like as a hairdresser or a dental assistant, or maybe you're getting into awkward reaching postures, like you're a mechanic or something like that. We also see it in people who are side sleepers, when we have to wrap the arm underneath us to fall asleep, or the arm overhead. That can cause some irritation in the rib cage. So, what can you do about it? Well, the first thing is you want to avoid that rounding posture as best as you can. So if you can think about squeezing shoulder blades together, that's going to give you a bit of relief. It won't necessarily feel good because it might feel a bit pinchy, but it's going to encourage the ribs to move into a better position. If we're stretching like that, that's just encouraging them to get a bit more rounded and a bit more irritated. Also think about your neck position. When we start to jut the head forward, like when we're driving or we're on the computer, then that naturally causes our shoulders to round as well. Again, putting those ribs in that rounded position. I'm going to be making a video all about specific exercises you can do for this problem, so watch out for that. If you have a foam roller at home, rolling out your upper back can be helpful as well. Anything that opens the chest and squeezes the shoulder blades together. Now, in our practice, how we would treat this is we'd work on those tight muscles between the shoulder blades and the spine, from the shoulder blade up to the neck, and maybe even work on the chest too, because if the chest muscles are tight, that's going to pull you into that rounded position. We might choose to do a bear hug style adjustment. That's good for ribs. If you're not a candidate for that manual cracking style adjustment, then we might choose to use the impulse tool. It helps us be really specific. It just does a series of taps that helps us get that joint moving a little bit better so it's not so dysfunctional and so irritated. And then we're also going to talk about your sleep position, your work positions, and give you some exercises to help prevent this from coming back and calm down the pain and irritation. If you'd like to book in for an appointment, you can book online at willowbrookchiropractic.com. You don't have to live with this problem. Some people think that there's nothing they can do, that they're just going to have this issue and pain for life. But we can help you. We can work on that. You don't have to live in pain. We post regular content under Willowbrook Chiropractic on YouTube, Facebook, and Instagram. If you have any question about what I talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.